Extensor retinaculum. So, extensor retinaculum is again the modification of deep fascia, and it is lying on the dorsum of the wrist here, and it is attached to the lower end of the radius, lower end of the ulna, and also the carpal bones on the medial side. So, deep to the extensor retinaculum, what happens? Extensor septas are given, and there is 6 compartments in which we have to know the extensor tendons passing through the individual compartments. So, again, extensor retinaculum is a modification of deep fascia. So, here if I talk about extensor retinaculum, it is important to understand the structures traversing between each compartment of the extensor compartment below the retinaculum, and it is also important to know the attachment. So, extensor retinaculum attachments. So, if I talk about the attachments, medially it is attached to stelloid process of ulnar bone and also to the corresponding carpal bone, that is tricuteral carpal bone and that of pisiform bone. Tricuteral and the pisiform carpal bone. Laterally, it is attached to the lower aspect, that is lower anterior aspect of radius bone. So, this is about the medial and lateral attachment of extensor retinaculum, which is a modification of deep fascia. And below extensor retinaculum, we have got extensor septa. So, there are 5 septas which is passing deep to it, which will form 6 compartment, and it is important for us to know the individual compartment the tendons passing. Has been asked so many times in the previous year MCQ sessions. So, firstly I would like to explain this and then I will write it for you. So, yes, let's talk about that. So, see here, this is the transverse section in which you can clearly see this is the cut end of the radius and the ulna, which has been shown to you. So, here we can clearly define the radius and the ulnar bone. Okay, now, so yes, we can clearly define this radius and the ulnar bone. Let me slightly enlarge this image. Now, we know that there is extensor retinaculum, and through which we have got deeper to it, we have got 6 compartments. So, here we have got following compartments. So, this is the first compartment, this is the second compartment, this is the third compartment, this is the fourth compartment, this is the fifth, and this is the sixth compartment. So, medially we have got the sixth, this is the fifth, this is the fourth, this is the third, and this is the second compartment. It is important for us to know the extensor tendons passing through this individual compartment. So, through the first compartment we have got 2 tendons passing, abductor pollicis longus and extensor pollicis brevis. So, the second extensor compartment, again we have got 2 tendons passing, ECRL and ECRB. Through the third extensor compartment, just 1 tendon passing, that is extensor pollicis longus. Now, through the fourth compartment, we have got the tendons of extensor indicis and extensor digitorum muscles, and other than that, which is not shown here, we have got 1 artery and we have got 1 nerve which is traversing. So, total we have got 4 structures traversing here. Here the nerve is PIN, posterior introosseous nerve, and the artery is anterior introosseous artery. Anterior introosseous artery. So, that means through the fourth compartment, 4 structures are traversing. So, the fifth compartment we have got extensor digitorum, digiti minimi, and the sixth compartment we have got extensor carpi ulnaris muscle traversing. It is important that we should know. So, this diagram is showing you all the tendons which is passing through the extensor compartment, but individual tendons. So, it is very easy to understand the muscle tendons of the lateral side or towards the thumb is going laterally, and through the medial aspect we have got the extensor carpi ulnaris and the digiti minimi muscle tendon. So, please write on that. Yes, so we can here utilize this space and we can write out structures passing below. Structures passing through extensor compartment. Structures passing through individual extensor compartments. So here, through first extensor compartment, the structures traversing is abductor pollicis longus tendon and extensor pollicis brevis. To the second compartment, we have got two muscle tendons passing, extensor carpi radialis longus, extensor carpi radialis brevis. Through the third compartment, we have got just one muscle tendon traversing, that is extensor pollicis longus. Through the fourth compartment, we have got four. The compartment is also fourth and the structures traversing is also 4 in number. The structures are extensor indicis, extensor digiti. So here extensor digitorum, actually it is ED for extensor digitorum, means for the 4 tendons, for the lateral 4, for the medial 4 tendons. Extensor indicis for the index finger. We have also got posterior introosseous nerve traversing and anterior introosseous artery traversing through it. To the fifth compartment, we have got extensor digiti minimi, extensor digiti minimi muscle for the fifth finger, extensor digiti minimi muscle tendon for the fifth finger, and through the sixth compartment, we have got extensor carpi ulnaris tendon traversing. So these are the 6 extensor compartment and the structures traversing through this individual compartment, which is very, very important for you to understand. And you have to know this individual compartment and structure traversing. This has been asked so many times in the previous year. So yes, we have done with this and we have seen the attachment and the structures traversing. Thank you. All the best.